what we know is that actually 80% of our health is determined socially. So not biomedically, clinically, but socially. So given what we know about the societal influence on our health, it really makes sense to think creatively about how creative approaches to health could support people to live healthier lives. I'm Helen Chatterjee. I'm a Professor of Human and Ecological Health at University College London, and that basically means I look at the interactions between the health of humans and the environment in which they live. I'm also a trustee of the National Centre for Creative Health. Creative health describes creative approaches and activities to promote health and well-being, to support standard clinical approaches to health. So helping people think creatively beyond the biomedical model. Where you live, where you're born, where you work, how you live your life, what kind of a house you live in, what kind of a job you've got, your income, your employment status. All of those factors we now know have a huge influence on your health, and in particular on your health outcomes. It really makes sense to think creatively about how creative approaches to health could support people to live healthier lives, both through prevention but also interventions, programmes, activities that support health creation in the community, within the society. Social prescribing describes essentially a referral pathway into community-based sources of support. The first kinds of social prescribing in the UK were arts-based. It might be art creation, it might be drawing, it might be painting, quite a lot of music, singing type activities, dance-related activities. We piloted a project called Museums on Prescription, where we started testing the idea of referrals into museums. So we worked with 7 different museums across London and Kent, and it was really exploring the same idea, having a referral into a museum for a series of weekly activities. What we're seeing now is a kind of proliferation of demand, particularly across the arts sector, I think, around offering social prescribing opportunities, programmes, but we know some challenges with that. There isn't really any funding following it. One of the biggest challenges is the sustainability of the offer, getting away from that idea of a one-off prescription that's, you go and do this for 6 weeks and it's going to cure you. We need the sustainability of provision to support people long-term in their health, to keep physically, cognitively, emotionally happy and have those opportunities available to everybody. When people engage creatively, so they're really deeply immersed and there's a lot of cognitive stuff going on, we know that all those ingredients together can see really positive outcomes. Outdoors, indoors, in museums, in art spaces, doing meditations in a gallery. Activities that incorporate all of those sorts of components we know have really good benefits. We've got really great evidence, for example, around singing and breathing type activities for people with specific lung conditions like COPD, chronic obstructive pulmonary disorder. Lots and lots of activities around supporting different aspects of mental health, those kind of tasks that involve art making. We know that people report about being immersed in the task and that being an opportunity to be distracted and immersed away from the challenges that they're facing, and then giving them the opportunity to think about creatively how they can tackle those problems. Really interesting stuff around, for example, movement-based activities, so for example performance. So great charities who are doing really brilliant work around working with people with Parkinson's, for example, working with stroke survivors, people with other neurological conditions. There's fantastic work going on. If we can really nail that sustainable funding offer, that will be a game changer. If we can nail things like every child gets arts, creativity, access to the outdoors, physical exercise, I would say fairly basic budgeting, things like cooking within their school environment, these will have big ramifications in terms of public health and in terms of tackling inequalities. And I don't think those are complicated things to achieve. It's just that they involve operating the system in a different way to how we currently operate it and how we currently fund it. So it involves cross-sector working, cross-government working and cross-funding working effectively, basically putting health and particularly health inequalities at the heart of the decision making. We just really need ways to keep the population physically active and cognitively active, eating the right stuff, spending time outdoors. So that's really where creative health comes into play. because we know that community-based solutions can often be much better triggers for supporting that kind of health giving or health creation within a community, rather than, for example, someone being told repeatedly by their poor GP who said it to them, 20 times, you've got to start doing more exercise, you've got to stop spending so much time on your own, you need to get out and about more, you've got to eat better. We know that that kind of public health messaging isn't effective. Conversely, we know that people who become engaged in creative tasks, community-based activities, if they're receiving that kind of information and they're co-constructing those ideas within a group, say around an arts activity or a dance activity, and they're having those kind of discussions, they're much, much likelier to implement those kind of healthier lifestyle changes. I think there is a positive direction change. One of the upsides of COVID was that a really enhanced understanding of what community is and that sense of community and the importance of access to community-based sources of support. And that, I think, in turn has led funders and policymakers to thinking about communities in a different way. We're seeing the word communities appearing much more in certainly the new government's rhetoric. So I think there are positive changes. We set up several years ago the Culture, Health and Wellbeing Alliance, which is a sector support organisation for anyone involved in creative health. And we've got over 6,000 members in that alliance. They're individual creative practitioners who are supporting health creation in the community through a series of arts engagement programmes. We've worked a lot with places like Tyne and Wear Archives and Museums, Beanie House of Art and Knowledge down in Canterbury. Completely changed the way that they operate, those organisations, to really place the communities and the populations that need it most at the heart of their provision. So I think there's lots of positives that can be done, and we're seeing that, the growth of that across the sector, which is really fantastic.